Hello and welcome again to another class, Poultry Science. Now in today's class we'll be looking at infectious laryngotracheitis. Now look at the name, long. You want to attempt to pronounce it, laryngotracheitis. Now this gives us a clue, a hint that it's an infection that occurs along the larynx, the trachea, now the windpipe. In other words, it's going to be, or it is, a respiratory problem. Now, from the name of certain ailments, you can tell certain things like its origin or the place where it's, the part of the body where it affects, or some other things about it. Now, laryngotracheitis is infectious. Now, what does it mean? It means it can go, flow or spread from one animal to the others. As a matter of fact, an entire flock can be affected just from one animal. So we have to know this. Knowledge is power, so that you know the presentation, how this thing affects, how the animal will look like when it's having this, and what you can do to prevent these things. Now let's get started in earnest. Now, what type of disease it is this? It is a respiratory disease. It is also infectious, making it very dangerous. Now, what's the presentation? The sufferer birds find it difficult to breathe. As a matter of fact, you begin to see high-pitched sound, like screeching, like the animal, the bird is snoring, but more than that. Now, it's usually common with chicken and pheasants. That is, not all chicken, not all poultry animals are susceptible to it. Now, what are the signs you see? You see, number one, difficulty in breathing. Anything that begins to affect the trachea and larynx, you know that it's actually going to affect difficulty. It's going to cause difficulty in breathing. Now, when difficulty in breathing happens, you will see darkening of the skin. Why? Now, you remember the blood has the component called hemoglobin. Is the oxygen carrying part in the blood. Now, by being red, the air in it, the oxygen in it, keeps it red and glowing. Now, when there's low supply of oxygen in the blood and there's no carrying of oxygen, molecules of oxygen are not attached to hemoglobin molecule, you begin to see that the blood is not going to be as reddish. Now that will appear. The same thing, you see someone who is anemic, a human being for example, you touch the tongue like this, you see that it's not as red as it ought to be. It's going to be a bit darkened. That's because of shortage of anemia, that is shortage of oxygen in the blood. The hemoglobin molecules are not having enough oxygen molecules attached to them. So what you have is darkening of the skin becomes dark. Then you also see high-pitched sequel or screeching sound, like you see a rusted hinge of a door. When you open the door and it's like something like that. So you begin to hear something like that screeching sound, like also like rats, when rats are chapping, chew, 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 it's things like that. You begin to see those kind of things, and it's coming from the nostrils of the bird. You begin to know that it's likely to be infectious laryngo. You also see the animals coughing, and in that case, you will be coughing out blood. So these are some of the things you look out for. Now, education is power. That is why we share this slide, so that you know certain things. When you see certain things, you'll be able to tell the person, oh, this is what is happening. You can even make certain the prescription for yourself, or better still actually ask your vet. Then, when you do a post-mortem examination, like we said, post-mortem means after death examination. What do you see? You see the trachea is actually bloody. Of course, difficulty in breathing. Before you know, blood is not flowing easily. It begins to get to parts of the body that it ought not to. In this case, particularly the trachea. Then, how do you prevent it? Vaccination is the way to prevent it. Especially if you look at a region that is very susceptible to this or endemic with respiratory infections. and let's say particularly you want to talk about laryngotracheitis, you want to take precaution, you want to prevent it by what? Giving vaccine. You have to be careful and be sure what you do. Now, a caution is this: you don't give it to birds except they are 4 weeks old and above, so the body will be able to make do with the attenuated vaccine pathogen that is being introduced. Now, the route, what we call route in Nigeria, what is called route in the US, the route by which you introduce it is through the eyes or through the nose. So you introduce it as a drop. That's a drop. That's the route. Now, one of the things that will help us early prevention is early diagnosis, so that you prevent spread all over the flock. So we don't just go to the flock to feed the chicken. You also look at them, observe. So when you start hearing certain sounds, you identify the one that is, and then take it out to where you have as your sick bay or the sick pen. Observe the animal. If you want to also give vaccine, you don't give only the one that is actually infected, you give to the entire flock, because some of these things are already spread, it's just waiting for time or seasons of manifestation. So thank you so much. If you have a question, please put in the comment section, and also like. Thank you so much for liking, thank you for sharing, thank you. This is valuable information. Some people put in so much money into poultry and they don't know why their birds are dying. So when you begin to see these things, these are valuable information. You'd also have a clue that, oh, this is what is likely to happen. You know what to do in subsequently. Thank you so much. Thank you so much. See you again next class. Please share, subscribe. Love you.